engagement today to be part of this forum, but also the organizations you represent as well. Again, it's so important for us all to play our role in the health of the children. So thank you for being a part of that. And let me now turn it over to Sharon McGill, so glad to have you and all of our panelists speak.
Well, I'm going to use the mic. Without silence, good afternoon, everyone. My name is Sharon McGill, and I am the proud CEO of Communities in School of Central Texas. We work on 100 campuses in 6 school districts across our region. We have provided services to this region for nearly 40 years to help students overcome barriers so they can be successful in school. Addressing the mental health needs of students is foundational to CCIS work. 2 years ago, we're so proud to be a part of an innovation. We started a new mental health and wellness program to support our school-based program managers. This ensured that students would have access to the supports they need to cope with mental health and wellness challenges. Our licensed mental health clinicians provide services to students directly in schools, which helps strengthen our research-based model of integrated student supports. This creates an equitable access and opportunity for students to receive the necessary services right where they need them and when they need them the most, directly in their home school. So we're so proud to welcome everyone, and we're so grateful that Equitable Care allowed us to come and talk a little bit about our program. But now I am pleased to introduce our moderator, Keith Reedy. Keith is a program manager of school-based team and system of care at Interval Care. Keith Newton has served as a school-based therapist for almost 9 years and recently became program manager for a section of the school-based team at Interval Care. Keith has primarily worked with high schoolers, he's a brave soul, and their families in Pflugerville over that time. Let's welcome Keith to moderate on our forum. Welcome.
Hello, everyone. I'm Keith Newton. I'm program manager with our school-based team, proud member of the school-based team at Integral Care. So I wanted to say welcome to everybody. This is for our virtual audience. This is a multilingual event. Everyone needs to select their preferred language. So if you're on a computer, you'll see a globe icon at the bottom of your screen. And if you're on a tablet or phone, you can click the 3 dots, then more, then language interpretation, and select your preferred language. Don't forget to press done. And also, if you have any problems with the language, please do not suffer in silence. Let us know in the chat. I also want to shout out our team that put things together and set us up. They've done a wonderful job and worked super hard. We have dealt with some technical issues though, so if you run into some of that, chat with us. I also wanted to suggest maybe using the closed caption options if you're having a hard time getting this. All right, y'all, let's get started with some good discussion. Thank you for joining us today at the Community Forum for Children's Mental Health, promoting access, equity, and engagement. This forum is co-presented with Dell Children's, which provides total health care for all care your child needs, from pediatric primary care to advanced specialty care and emergency care. Also, just to let you know, we are recording today's hybrid forum, which, man, hybrid, y'all know the technical difficulty, right? It's tough to do. So again, shout out to everybody. But it's a hybrid forum today and streaming on Facebook. We're also providing CEUs, continuing education units, to receive your CEU certificate. Please sign in at the beginning of the forum and complete the survey at the end. Virtual attendees will see the chat box for the links and further instructions for that. And in-person folks will be using good old-fashioned paper and sign-in, so look for those. Integral Care is the designated local authority for mental health and intellectual and developmental disability for Travis County. For over 50 years, we have supported adults and children living with mental illness, substance use disorder, and intellectual and/or developmental disabilities. In recent years, we have seen significant increases in certain mental health disorders in children and youth, including depression, anxiety, suicidal ideation, and then the pandemic era introduced a whole new set of challenges, as we all know, especially for children and youth. But children and teens have been struggling for far longer than even then. According to the CDC's Youth Risk Behavior Surveillance System, feelings of persistent sadness, hopelessness, and suicidal thoughts and behaviors have increased by about 40% among young people over the last 10 years leading up to the pandemic. So plenty going on even before we hit the pandemic. So that sets the backdrop for our panelists. I'm honored to welcome today our panelists who will be discussing equity, access, and engagement today in our world and with children's mental health. First, here we have in the middle Mr. Keanis Williams, who has called Austin home since 2018. As a devoted father of two and happily married for 5 years, he has seamlessly blended family life with a successful career in health and wellness. To Keanis' left, we have Ms. Veronica Gonzalez Rivera, who's been a part of Austin ISD for 25 years, y'all. Yeah. Her role as a parent support specialist allows her to connect with families and communities in many capacities. She teaches adult classes and connects families with community resources. And directly to my left, we have Dr. Pooja Patel, who is a pediatric psychologist and an assistant professor in the Department of Psychiatry and Behavioral Sciences. She is currently serving as Director of Pediatric Psychology at Dell Children's Medical Center. So thank you all for being with us today. We'll start with a panel discussion, and then towards the end, we'll take questions from the audience, both in person and as well as online. In person, folks, you can see the index cards on your tables. If you fill those out and pass it to our volunteers, they will make their way up here to us. For virtual attendees, you can type in your questions to the Q&A at the bottom of your screen. We're going to get to as many as we can today, but in case we run out of time, if you can include your email on there, we can follow up with you. All right, to the questions. Number one, we know that mental health is shaped by many factors, including individual traits, our families, communities, environment, culture, and society at large. These factors influence how people seek mental health care. So from y'all's diverse perspectives, how do people get access to mental health services?
With Austin Independent School District, there's multiple ways of getting mental health assistance, depending on the outcry or the needs and necessities of the family, as well as what their culture is. I tend to work with my counselor and our licensed mental health professional. We have them per vertical team, and we meet with the families and we assess what their needs are, and then we go ahead and we refer them to agencies that one, they choose of their own accord because it matches with what their cultural and moral beliefs might be, and that would assist them in the best way possible.
So I'm particularly loud. From my perspective, when it comes to the role of things, I'm following important by day, and I'm a worse consultant by night. But the mental health access, especially for fathers and the community, is very difficult. There's a stigma, the stigma is that the men of the community can take care of it, but at the same time, a lot of women don't have access when they're really struggling. There's a mentality that I have to push through, but at the same time, that man so really part of himself, and that natural balance is very accept. So a lot of times when we see a lot of kids that are having mental issues, kids that are doing things they shouldn't be doing, or they're struggling in life, a lot of times because they don't have a strong mental community around to show them what it looks like for them to really struggling themselves, right? And so what I do in the organization that I'm a part of, is Black and Social the awesome housing authority, IDAS program that was made, is that we try to provide the space we need to open up. We try to provide the space that we need to get that off their children, whether or not we can provide them with basic resources, whether or not we provide them with childcare, whatever the case may be, we try to eliminate the obstacles that need to get things off their chest. Right, and then we kind of play them with the community partners, kind of get them to the areas of what we do in our organizations, or that we go on behalf of the medical itself. We don't just give you a phone number and say, we call it first. We kind of go a little bit, we try to go a little bit past that, and we walk through the process. Because a lot of times they're already struggling with economic issues, they're struggling with mental issues, they're struggling with financial issues, and there's so many different things that they're worried about that they have is just exhausting. And so we really walk within the space to just talk about, and as a mental health instructor, is that we try to do parents to get mental health aid so they can see what the kids are really doing. Also, the parents, I'll tell everybody we're all good kids in their lives. So a lot of us still have mental health issues that come from our childhood traumas. And so if we don't get the parents, the mental health that they need, then they're just going to keep passing still on down to the generation. And so the organizations that we do down part is that we just try to put the parent to be a better parent so that they can be a better parent to kids and their generation science.
Delta from this perspective, we really want to provide comprehensive care to youth. And so in terms of clinical access, we are here for medical appointments and having challenges so that we can primary care to specialty care. We have mental health services. So as your experience goes on with treatments, for us getting care, but also extending out into the community. Just thinking about our programs extend out. So we're also embedded within the schools, within the partnerships. And we also are embedded within community specialist offices to have access to help with the identification, but also how to provide referrals and create partnerships. Because we think about taking access and just providing care where kids are, with people that know these kids the best and noticing those challenges with trusted people, and they can have that identification and the people are willing to engage in that support. So that's kind of where I want to.
Thank you. All right, y'all, equity. What does equity look like in children's mental health? Let Tiana start us off on this.
Equity in a child is just to be a child. There's so many different things that cause kids to not be kids that they grow up as these closed off adults. And so what we want to do is so what we want to do is to create a space for the kid to be a kid. But we have to make sure that the parent is able to create that space as well. And equity is just, not only just financially, but emotionally, also physically. Health personal training, there's a lot of areas of food business. So a lot of kids aren't getting, a lot of mental issues come from kids not having the right nutrition. But mom and dad are struggling so bad, they just got to put food on the table, but it's not always the best. And then being able to provide those two different necessities that they need. And so we can as many stresses as they can. We want to try to eliminate the stresses so the kids can have this, be our good self.
Another big barrier is cost, right? So when we identify that a kid has a need, then being able to insurance. Many children who even have insured families don't have mental health carve-outs, many families don't have insurance. So then cost becomes a barrier to even getting the help needed, right? So then there's equity within that. And then if you are able to find a provider that does, and you can see them, are they able to provide that care that you can access with the proper language for access to language support so that they can engage in that care. So that creates a significant challenge for our youth right now.
In the district, equity means that every child has access to everything in the same manner, but we know that that doesn't always happen, right? And so my job is to help find these resources so that the families that we do work with, especially in the economically disadvantaged schools, that they have that access, that we match them with the access that is not gonna cost them anything, that's gonna give them their maximum potential. And that's equity for also in the school district.
Thanks, y'all. Yeah, I'm just imagining what it all are all talking about and how spread staying and how people are ever doing the best and provide that equity, but man, you know, some of the news lately, it's all the barriers and how stretched and also just brings to mind all the people who are probably watching and all the good work that's happening out there to try to create the access and equity we've been talking about. So, that's on my mind. So thank you to y'all who are doing that work and thank you for watching today. All right, let's talk about the engagement a little bit. I'll tell you my bias is extra interested in this one. In our school-based work, we're trying to create the access as well, and obviously certainly trying to focus on equity. But for whatever reason, the engagement piece, I'm always like, all right, we're there. Now, how do we actually get the interest of these kids and these families? So talking about the engagement, especially with youth and mental health, how do we engage youth in discussions about mental health and engage those folks in that?
I think a big part of that is starting the discussion, just the education. Reducing the stigma. It's okay to not be okay, right? And making it a part of wellness. And in the conversations within our academic settings in schools, within sort of athletics, just in all parts of life, just starting to notice that mental health is a part of our physical health and it's a part of our well-being. And so I think that's the biggest piece, that just creating that education, that we have programs where we have teams going out and kind of creating those partnerships to spread the word. But it starts with just even conversations we have individually. The parents telling their children that, sometimes I get sad, and this is what I do to cope. Just making it part of the conversation is such an important piece. Because if we don't identify the need, we're not getting help if we're suffering in silence.
So I'm very issues. But one of the things that, from the state of the first aid is you have to meet the families where they are. When you look at it from a daily perspective, we don't see our kids more than they out. So we don't really know what's going on. But when that time, we really see our kids really see, right? So the meeting of first aid is to meet where they are, so that out them and part of the places is to meet them in the cultural aspects. Where am I going to find parents and kids in the same place at the same time? Church, schools, put those two together so you can find people. And so what I've done is partner with different churches and going in and finding grants, finding individuals to live and cover the cost in order to do mental health aid teaching to the parents, to the youth ministries, to the evangelism and evangelical ministries, and then being able to get those people within the church, go within the community certified. So now that it's not always on the mind to do. I'm a firm believer in it takes a village to raise a child, and there's a lot of families that don't have a village, and the parents are so overwhelmed with moving on that if you quick people to build around, they can make it a little easier for them. And then when it comes to the sporting aspect, is equipping the coaches. I was an athlete, so I know that athlete life can be real well that you get up there. But when you equip the coaches, a lot of these kids are in sport because this is only saving that they have. And so what we want to do is to show that it's a healthy outlet, not only we are people here, but if athletics does not work out, they want to down the spiral, but they don't have an outlet. So we want to have coaches teaching these kids about mental health, showing these kids what it looks like, and they see some signs of this kid is going through something, they can pull that kid aside and talk to them, because freaking yelling at them, even though we don't need them, could be a trigger, a tipping point for that child, right? And so the new number of days is more of an equipping goals to recognize the situation in those kids, so that they have the ability to see what we don't want us to see. We hear a lot where kids are showing a sign, they're crying for it, but we don't see it because this is who they are, or who they are. But if we can see those things and we don't address it, then we can start getting moving, and we can start reaching out to the local organizations to have resources.
And I agree with everyone listening. In my classroom, my job is to teach social emotional learning to, and to identify, not only what they see themselves, but how that reflects in their children. And also to identify with their children in those feelings. And so I start those from the beginning of the school year until the end of the school year, based on the lessons that are being taught throughout the school year as well to kids. And that's how I connect them with them being able to talk to their kids, right? Instead of saying, how was your day? How did you feel today? Right? How do you feel right now? Just different ways of conversing with their children instead of the original way that we all came to learn, right?
Thank you. Also, I've got two more questions for our panel, so just wanted to remind y'all to start getting those questions in order and put them in the chat as you think of those and great discussions so far. So, summer break's coming up, y'all, which usually makes people scream for excitement or scream for terror. So summer's coming up. Do you have any guidance for parents and caregivers on how they can support their children's mental well-being, especially going into summer?
One thing that I can say in multiple ways is really good at present. I try to teach and talk to my fathers is that the more present you are, the more secure your child is. And when summer comes up, a lot of parents freak out often this week because it's like, what do I do with school for 8 hours? I don't know what to do. I got all this to sit at work, the kids here, now they're sitting for food, whatever it's like be. But being able to just be present in that moment, because sometimes those kids are deeply clingy in those moments because they have not seen you all. They're not seeing you all. Now they're home for 2 months. And some parents shoot their kids off. But we just want to again learn how to have a conversation with the kid to figure out what their day is. Try to carve out some time to just spend 5, 10, 15 minutes doing something they want to do. And for those parents that are real busy, and they work all day and finally home, just taking that 10 minutes if you want to do. And it's like on the weekend, you have that opportunity. Like I said, the school is real big, but we have to go beyond just those things. And I think at home, just spending time with the kids, right? And I can't stress that enough. Even if we're so busy, we still have a small little pockets to make our kids feel secure. Because what happens is sometimes those kids are so secure with the teachers that they don't feel anything else to care. And then the kid go through something that the parent never knew about because we never took the time to talk to them. So I think the summer is the best time to do that because we're going to see their kid about it.
So summer break, that's difficult, right? Because we build these bonds, like you were saying, we build bonds with teachers, they build bonds with the staff, and so then the parents will have to. So for me, what I do for my parents is I definitely have an online resources guide that I text to them, email to them, they can save it, download it, and access it at all times. So in there I put all kinds of information, but the biggest information I always tell them is have fun with your kids, right? There are so many free activities in Austin, so many places to walk, so many places to do whatever, you can take a picnic in your backyard, right? So I attach links to ideas like that they can have that bonding experience with their kid. I also provide them with, the Learning on Spinning, where they can find all kinds of things to do. And not only physically reach them, but keep them, reading or investigating fine arts in the city, because there's so many fun things to do. That's free. And so I make sure they know about all of this information. I put information on me, so they can personally go there. They have this amazing PowerPoint presentation where it's multilingual and it has questions and how do you do this, and then it provides you all the links to mental health facilities or organizations within Austin that you can have access to, which is super important. Because on the downside, you have your 2 plus, right? So yeah, it's like, ooh, who's gonna break first sometimes? And so you have to take care of yourself too, not just them. That's the other part. If you don't take care of yourself, how can you take care of somebody else? So I always tell my parents, take time out. And my time, which we go like, you're crazy, is from 4 to 6 a.m. Because nobody's awake. And I have plenty of time to do things in 2 hours, but you have to carve out a space for yourself, for you to meditate, for you to process your day and how you're gonna function. Because if you don't, it doesn't, the day doesn't come out good, right? So take care of yourself first and then take care of your kids.
Appreciate one of those responses. We also have, if for youth, there is an identified mental health need, so I'm going to talk about services. We have the Texas Child Health through Telemedicine program, our T-CHAP program, which operates in the schools during the school year, but also in the summer. So it's a free telehealth program. And you know, typically in the school year, we have an average of 5 sessions, but in the summer we can extend that out a little bit more. And so connected with youth that way, maybe ongoing mental health support. It's virtual, so they can do it from home. Parents can do it from work if they need to, but increasing that access, reducing the burden of cost is an opportunity. We also provide support through pediatricians, and so that's our child psychiatric access network. It's a hotline, so if pediatricians notice there's a change or it's something that's happening that's challenging for their patients, they can call the hotline and get support from the psychiatrist to help provide referrals, but also inpatient support. So just some additional ways to get that mental health support just within the community.
Thanks. Okay, we will start the Q&A here in a second, but one last question for me and for the panel here. We have a question about the specifics of social media and negative impacts. And so the question for the panel today, how can I protect my child from the possible negative impacts social media can have on mental health?
Well, let me tell you, I have a 9-year-old and she's like, Mom, when can I get a phone? I said, when you pay your bill, right? Because they just don't want to get a cheap phone, they want that iPhone. So I, as a parent, I don't feel that our young children, right, need a phone. But they don't. Because it's a tool that you're opening up to put yourself in this situation about social media. I think it takes older age children to where you need to talk to about these things. I work at the elementary level and we want to teach our kids how to keep safe. But we have come across an issue where they're like, my kid is being bullied on social media. They're serious. Nobody will answer to a phone, right? So sometimes, and this is hard, a lot of people don't like to do this, but we put our kids in that situation, right? Because we hand them the tools. We want them up with the Joneses and everybody else. Schools have phones. They can't use them, they have to put them away, right? Social media is something that I feel like is teenager enough, and then you can have open conversations about the bullying, the trusting people on social media, and things like that. So we have to put that on ourselves. How much are we willing to let our kids be in that situation when we don't have to?
I do agree. I think it's really important to take the child's development into account and also participate with monitoring social media use. One of the things that I will say that is the most scary part to me is that when we get on social media, there are so many experts, right? Experts in mental health, experts telling you how to about a certain disorder or all of these things. And as children and youth, we might not be able to discern, and even some adults, right? We can't tell, is this accurate information? Is this the right information I should follow? And I think that's a really good track. And so what I would say is as families decide that they want their child to have access, have it be a conversation. Be sure that you are open and available to talk about the things they are seeing and doing, because you're not going to be able to protect them from everything all the time, but you can be their sounding board to help them detect, is this good information? How do I get the right support, right? Because otherwise, it's just this whole area that that is so scary.
I have a 7-year-old and a PG, and it's crazy that a 7-year-old is young to do this. That's like crazy. I want to be an astronaut and figure out how to say something like that. But the effects of social media is very weird when it comes to kids, because what happens is that we're always seeing somebody's highlight reel, we're never seeing their work, we're not seeing the truth, the reality. And so what happens that I see a lot of kids is that when they see these different things on social media, they see these extravagant lifestyles, they see these kids doing certain things, it makes them resent what they come from to do about. And then now there's like this inner resentment toward mom and dad and probably why do we do that? Why do we have to go? Why do I have to go? So it becomes this comparison system where the kids, they really don't want to be who they are. They don't accept it. And then there's reality crisis. And we also see the parents, to where the parents are, I think myself sometimes, really slowly mindless. And we pass that on to the kid, because we're sitting having a conversation and we're scrolling through our phone, looking at somebody else's life, not saying that we have a life right in front of us and we become great. And I would also agree that my kid only has an iPad, but everything on it is not. And my kid cannot go on the app is not there. If I can say, hey Siri, I'm going to that's the only way. That's the only way you communicate on anything you see. We have certain games that we careful they play as well. Those chat rooms and those streaming, my kids not allowed to watch streaming because it's the behavior behavior check. I started doing this to my 7-year-old every time he watches an iPad and said, hey, go to the room, you have an hour. Now he comes back as an attitude. What's the attitude? That's not you, what's going on. He's in the Roblox or Minecraft or whatever, and these kids are like kids that are on, so they're saying things that's either upsetting him, or he's trying to be like it. He wants to fit in, he wants to be a part of that. And so they're like, sometimes grown adults, they're like, you have to be careful about that too. A lot of grown people that are playing together with children. And so I think the effects of social media, if we don't, like I said, if we don't like as parents take responsibility for it, we're going to lose that kid. Because what happens is comparison is really good. And these kids are, it's a part of their life, it's every. Like my son is wrong, you only know my phone. If something goes wrong, you say my phone. I need you to call, you call me all the time. But like just being able to put those parameters and barriers like in front of you, it explains it. Because sometimes we do, we can let us the comparison that when someone said has on why I can have, I'm not saying it's a man. If someone in my body on me, but then you have to have an open dialogue with your kid of this is my house. I'm raising you a certain way. And this is how we're going to do it. I'm actually protecting, not trying to punish. And it's a dialogue between the two. If you don't have that dialogue, they're going to extend it. We're already peer-based. And so if I'm not going to do it and really have a phone, you make fun of you, you don't enjoy that. Right? So you have to be able to find some kind of way that to do it very down. These machines, like, I don't know. But now you have to be able to, not compensate, but just make sure it doesn't understand.
Yeah, I appreciate you bringing up the modeling aspect too, because I know I'm guilty of doing some of those same things and some of them striving to work on doing that modeling piece and stuff. All right, we got another great question here on access. Keep sending in your questions. Access to culturally affirming care. So the question, how do you ensure that families have access to culturally affirming care? You know what? On it. You ready?
So with the district, we have many organizations that are vendors for us. A lot of them are nonprofit. We investigate these to the fullest, right? Because we don't want, that's why they have to become a vendor, right? They shouldn't have access to somebody that has cultural needs, right? Austin is a multilingual community with thousands of religions, thousands of cultural ideals, and organizations should not cheat them, right? And so, we make sure that these organizations are 100% what they say they are and offer what they say they do, and that they cater to the correct, culture, right?
We similarly, when we are providing referrals to families, especially through community-based programs, we'll vet the referrals and try to create a match system. And when we're talking to families about what referrals we want to make, we ask them things that are important to them, the language they're looking at, right? Matching is matching cultural background important, and really looking at those factors. And one of the things that we run into is that there's a shortage of providers sometimes that can create that match. And what we have been lucky, and we've come to a lot of really challenging things, right? But one of the things that it helped expand us and propel us forward was with virtual care. And so we are able to find more matches through telehealth. That might not be within the distance, but still can create those variables of connection and engagement that family needs. So that's been a gift.
The cultural aspect is that, as you mentioned, just said that there are a lack of representation. And so I feel that when it comes to certain areas, certain spaces and places, we have to find people that are culturally into, right? Not every single system works for every single person. Just because it's a policy and procedure does not mean that this one is going to reciprocate the way that it's really not thinking. And so I try to do my organization is that the first thing I try to figure out is what do you need? Like I can say you need to do something, but you have a full-time job, you may not need that. But I can probably find a resource that will bring the culture. But I have to also look at the culture with that. I'm thinking we're in this, we're going to do the and then I go to those organizations that fit that. Because now if I'm going to send you somewhere, I want you to feel confident with that. Because a lot of times people walk into the room, see no faces that look like that, or no matter what they were living, or they were missing, and then they come. Because now what they are the systems is that now you just now you just report, now you just a case. And what happens is because people are fearful, and now there's this internal trauma of you're just going to do your job, you're not going to do your part. And then sometimes people get lost in the system, they get lost in the family, and being able to send them somewhere where people know what you do. And somebody, that's why I really like I guess that my ambassadors are actually following what they do because they know what you're about. It's easy for me, I'm going to see you go to their pride to say, hey, I have the resources. If you ask me what is the program, now I'm going to text the person. I want to do the program. I don't know. This is what they do for me. Rather than just being, well, somebody gave me a call and I can just figure it out. Now I'm calling somebody, I feel about me, and I the question on the phone, when I go and I got brought into package, and then it's like, but when you have that organization, somebody doing like therapy, therapists and things like that, different organizations that bring these, Latino, colored, therapists, it's like when they walk into a home, we can have a conversation with you. Maybe that therapist was that little kid that grew up in poverty. So now I can understand what you're talking about, and not just about ignorance. So now I'm having emotional, and then now because of my condition, I'm going to do more. And I think that those are the things that we have to kind of start doing, like giving people, when you typically such. I know in Black community that we don't believe in people. We struggle with that because we feel that therapy, even if it's something that we don't believe in therapy because what it does is it makes you feel like my feelings are good. Or it makes you feel that it's something you put in target on the back. But in actuality, we need that. So we need more people like us to say, you know what, I'm going to change so y'all understand. Like, we all need it. We all need help. So I think there's equipment about people. And not just the big, I know that's a big issue, you do this job. But they don't really have an actual connection with this stuff, and it's still a lifestyle.
We have some facts over here. Next question is about resources and accounts. I like what you said, like, to know the person, let's personalize and individualize these resources. But people want some names too, some specific resources. So this is a multi-part question. Maybe some of the most frequent resources y'all provide to people for additional support. Specifically, they ask beyond psychiatrists for children and autism, et cetera. They're also saying, hey, where do y'all work? Can you repeat your agency and your position so everyone can hear where we all belong? Can you share the online resources that you might give parents again, and then specifically with the telehealth programs, you know, speak a little bit more to that. So for my piece of that, again, I'm with Integral Care and our school-based team programming with our school-based team.
We just tell adults learning Southwell Medical School. Lots of programs, but the telehealth program is the T-Chat program. We partner with in Central Texas. We have many partnerships with school districts, but the program itself runs across the state of Texas.
John Williams, I really, I'm that, so really do like, I say yes to it. But I'm a follower of the coordinator of the IDAS program, involved in the see and that's through the Austin Housing Authority. So I work with another author and community or all big. I'm doing brothers who can follow the sure. So big brother that seems to be very school, even when cooking, not working the job. So I'm considering quality. So they bring a lot of open in the city. Also, I'm the medicine liaison in the Public Wellness Delivery for the Black Men's Open. We partner with the African American Foundation, clinical care, on some public health. But we kind of bring a different perspective. It's not just Black community, but we do know that Black community are what I guess disproportionate solar infected area. So when we try to do try to create space opportunity for them to be seen. So we want to bring that and how political one-stop shop is a lot harder. And so I help you with fitness, and I bring the churches, and I help you with ministries, the churches. That's what I'm trying to do. When we serve clearly, doesn't matter if it's that's what we want to know that we have a service with them. See. And then I'm just a one since I think we need to do something like this and share. So I love to do something like that. I have a few days off of it. I'm unfortunately, but I help people with strategies for it. I'm saying this is like this solution is I can do this inside of the from the literacy, I have to learn that on my own, right? So I'm going to do it. So yeah, so I'm just doing lots of things.
I'm Veronica Rivera. I am a parent support specialist for Austin Independent School District in South Austin. The organizations that I use, especially when I send stuff home for the children, would be NAMI. NAMI is one of them because they have a PowerPoint presentation which connects families to all mental health junctions, from suicide prevention lines to mother helplines to Austin Integral Care to here to their children, to anywhere they have all that information attached. It's like a really one-stop shop. Also, I said, but in Austin, that's one for families to engage children for free activities throughout Austin during the summertime. I think those are the two that I mentioned for the summertime fun. So my job is teaching parents to advocate for themselves, right? I inform them of district policy, right? Where their children are supposed to be learning when they're supposed to be learning them. I also connect them with resources that not only have to do with mental health, but also like food humanities, or I bring food to nice school to organizations that are willing to go and please to these amazing families. We also connect families, with, utility, all kinds of things that talk mental health and mental anguish, for families who are economically disadvantaged, right? Because often it's expensive. Just paying rent alone sometimes takes them months to get back on track. And so that's what a parent support specialist is.
Thanks, y'all. Fantastic resources. And I was gonna mention NAMI, I feel like you can spell that name. It's NAMI. M is in mom. I think I'm saying that. Let's see, I think this one was probably more directed towards community mental health workers in the workforce, but maybe parents as well. But it's about self-care and what y'all do. So this work is incredibly demanding, right? Access, engagement, and equity. How do you practice self-care?
I think I touched on this a little bit. I know that every day, Monday through Friday, I wake up at 4 a.m. and that's my time to meditate, to pray, to think about my day, to take that hot shower without anybody knocking on the doors. To drink a cup of coffee in silence on the porch. But you know, that's just a part of me. And just to collect myself for the day. And then 6 o'clock hits and mommy mode starts, right? Work mode starts, right? You're moving to your household, but I give myself 2 hours every day to myself. Right? Because I wouldn't survive the day if I didn't. And that's part of my self-care routine. Also, in those 2 hours, I'm also making sure laundry's done, right? I put the laundry, I make sure so that I have less activities to do on Saturday and Sunday, and then I can give myself to my kids as well. So within those 2 hours, I'm also doing tips, just getting them out of there.
I usually like it too. So I'm gonna check this person, but it can also be a place in the first, we want to feel feelings and feel anxiety, those guys. But I get up at 5:45, it used to be 5, but I have to go, so I'm just gonna be, so I'm not good. But I'm one of those dads, and I like to be there. So I typically do that. But as a personal trainer, is what I do my trade, cycles and I was in the job. You have to take time for yourself. You can't afford water to cook and food. You can't just keep pouring water to breathing. And so if you know that spending time is simply that they don't want to do that, but if you can finally deal with gaps, for at least an hour, 10, 15 minutes is all right. That's not, let's be honest. You got 23 other hours, you gotta get somebody. So I get up in the morning, I go to the gym, I work out on the but this for me is my home circuit. One of my biggest things is that I'm gonna go to my family and see it. So I take a really part of my body. So I get up, I work out, that's the first thing, no matter how something my day is. Your body is the one thing that you can do self-criticism. Like that's the one, it's like the only thing you know enjoy. So when I get up and give me a little workout, sweat, get my mind clear, like maybe somebody else is doing this stuff really good. No matter how simple my day, like they myself. Right. Then after that, I started reading the Bible, I pray. So I'm doing, I'm doing podcasts here, this is some music that I'm doing, and I'm thinking about what I'm putting on food, I'm putting on the table, watching some exhibitions, I like this watching. And then 6:45 hit, kids will run off. And I can get real chaotic. But those 2 hours and a half that I gave myself, even when I get down to the day and I gotta get back here all the time, that's when I'm like, more places. I'm not running around washing dishes, I'm not running around holding laundry. It's like, I gave myself time, I gave my work time, I gave the kids time, I gave my life. Right, and on the weekends, I'm a free boy. I would think that take it every year, we get into it, you know, 3 years in school to probably, you know, lots of something. But that's just what I do personally, but everyone has their own way to do it, you know, which you have to do, you know. And I noticed that my anxieties and frustrations are sitting over to my son. The way I stress out about money, my sons are listen. I started listening, my son start asking for something after going to school, and I'm probably stressing out about money or something like that. I would like, you shouldn't do it like that. And but that's because I'm getting all along with it. I didn't take time to calm myself down and I just got up something like that. So I think that in response, something you said, you know, it'll really pass like, you know,
We shows a early riser, which would be, that sounds so. Myself here, I really like to sleep, actually, that's important to me, and that my well-being can rest on that, my ability to be patient, and have more bandwidth. And I also get really nervous, but I think the other piece, I think, is thinking about your energy, what recharges your energy, and so for me, it is about connecting with people. And so I think that's time to, as busy as I am, to have this connection to my friends, to my community, and not talk about work or the things I have to do, but just enjoy and just be mindful of the moments. Because I can always think about the 10 things I have to do as soon as I get here, and the 10 things I've left behind before this, right? All the check boxes, but we can just be in the moments, and that helps to ground me and enjoy, you know, where I'm at, not feel overwhelmed. And you know, being working to support a lot of our teams for the hospital, we have the Center for Resiliency, and part of every so that is like a program that you can go through and help develop your own practice kind of type of work, which I think is really helpful. And every time I interview someone, especially when it's working in the health field, I ask, how do you balance work life? How do you take care of yourself? Because for so long, you know, all my training before this, the virus in this role, that wasn't as big of a conversation. So I try to model it. I try to take time away and kind of show it's okay to be time, go pick up your kid, come back, you know, do the things you need to do to have a great balance and boundaries and take care of yourself. Because if you're not here, you can't do the good work. So really great that everything is too.
All right, we're gonna try to get 2 more in, y'all. Maybe this one's a quick hitter a little bit. It's asking about residential treatment, which think about access, right? I don't know, but interesting question. What is your opinion on residential treatment being more of a proactive treatment for youth rather than the last option after hospitalizations that many in family see it as?
I would say that's what the mental health rescue training comes in. My goal personally for myself as an instructor is to partner with schools and organizations to come in and make it like, once you certify as 3 years, I would like to come in and provide that for the employees, also do that for the school and the teacher, so that that's being proactive. That's being, okay, we're not going to be able to like crisis before we decide who is need this kid, we want to get to. This is more okay, you know, if we just put the whole thing, then you can kind of leave it in some of the, you know, the gray area. But if we just do it, teachers as well, and coaches, and, you know, the church leaders, like everyone, I feel like everybody should certify because if you're around kids, you need to know what you're doing. You need to be able to ask the right questions. And I feel like you want to speak, but I even don't have, you know, I like being there just because, but I get certificate quick. I like that it's better than somebody. So having that, especially for some of those families that you go to college, you go to school, providing them with a certificate to say, hey, I took $8 a day, so I can learn how to play for my kid and for myself. That's being proactive. That's saying like, you know, give yourself a bit of you know, you read. Oh, yeah, I need to do that. So the proactive stuff, I like that's because in the day, you know, the kid really need that. If you have remember the observation. If my mom and dad did not have certain things, they all wanted to make sure that I had something that they didn't have. So one thing that we can start asking out now is to those things to our kids, right? Or we need to be mentally stable so that we have something like that. That's nice.
I do agree that being part of mental health care solutions and the ongoing challenge of crisis is prevention and starting early. And I would say that residential treatment for some kids in certain circumstances can be the right treatment option, and where I feel like for those special cases, I think it's unfortunate that you have to fail certain levels of care before you can get there. I wish that if it was identified as a big kids need, can we help them get there? And there aren't enough facilities anyways, right? So I think mental health in general has a lot of challenges, and so far we're just trying to keep up with the acute crisis, right? Keeping kids okay. If we could start further down and come at the beginning, right? We're moving towards prevention, intervention, education, then we'll downward strain. Some of these challenges might be easier to access, right? The systems might not be as overloaded.
In the district, it's a lot of things like that control thing have to happen. For somebody to say, this child will benefit from the military treatment. Right, because it's different tiers, right? The child has to show different types of crises. The family has to go through different type of crises before any agency will say this is where this child belongs, right? So it's not something that we can say automatically, yes, this child belongs there, because a lot has to happen before that can go through. So I just want to say, no, that yeah, you have to train yourself, you have to learn about the conditions that your children have, so that you can prevent, right? And always seek help. Don't think no for an answer, because a lot of people are going to tell you no, and if you quit, then you're not going to get what you want to get your children to or your family to be stabilized, right? So don't ever take no for an answer, because where one door closes, a window is open, right? So always look for help. Even if one of the reasons going to tell you, we want to keep going. Because you're going to come upon somebody that's going to say, I know what we're going to do, right? So don't give up, because takes a while.
Great answers. Also, I got some extra announcements, so I lied. That was the last question. First and foremost, thank you to our panelists for being here. Thank you for your time and for your insights. Also, thank you to everyone who joined us in person today. Thank y'all, and thank you for everyone who joined online. Thank you, Austin ISD, for providing Spanish interpreters for this forum. Thank you, Dale Children's, for allowing us to use this beautiful training room. And a couple of other announcements. For those of you seeking CEUs, please complete the CEU evaluation and download the certificate. And you can see the Zoom chat for further instructions. And then for all attendees, when the forum ends, you'll be prompted to take a short survey. So we hope that you can take a few minutes to share your opinion about our forum today. And very finally today, I wanted to announce our new CEO at Integral Care. Up to say a few words, Mr. Jeff Richardson.
Thanks, guys. Again, let's give all these guys a hand of applause. I want to thank everyone for being here today, both in person or virtual. Folks in person, we had a yummy cookies with our lunch, so I invite you to come in person next time. But I really want to thank our panelists from Pooja to Kianis to Veronica and Denise for moderating. So thank you all for your great work and your inspiration. Thank you so much. And at Integral Care, we deeply believe that helping families are the cornerstone of this thriving community. Our team of experts are dedicated to ensuring that families have the skills and resources needed to flourish. We're providing counseling for emotional well-being, to improving communication with families, and assisting in finding safe and affordable housing when necessary. We're committed to supporting every aspect of family life. In addition to our direct support for families, we also offer a range of services to the broader community and promote health and mental well-being. This includes our children's mental health toolkit, Ask Us and Talk Repeat resources, and as you heard earlier, the youth mental health first aid training, which is a fabulous training. And again, if you haven't been through that, or I would encourage you to go as a trainer or go through a class. It's an important service. And yes, I love your discussion about where to deliver that kind of a training. There's lots of really great places for us to get out in the community and do that. And then lastly, once again, I really want to thank you for being here. Your presence and your engagement really mean a lot. And I think one of the things for being a newbie to Austin is it's so nice to see this kind of a partnership at the table. And as a clinician, I've been a clinician for 30 years. I'm so grateful for all the work that you all do every day. And I know working with children is so critical to our success as a community. So thank you all and have a wonderful day.